Thank you, Madam Deputy Speaker, and it's a pleasure to close on behalf of the Government. Many of us on these benches remember the last Labour Government's proud history of public health measures. Indeed, some of us were here. From the indoor smoking ban to putting an end to cigarette advertising, we took the bold action to drive down smoking prevalence, and the country is still feeling the benefits of those policies today. But after 14 years of public health neglect, we have seen much of our hard work squandered. Health inequalities have grown worse. Life expectancy is stalling. And most appallingly of all, it's going into reverse in some communities. I want to thank my honourable friend for that contribution, not least because it allows me to place on record this government's thanks to Javed Khan for the work that he did in his review into smoking. And I want to say to my honourable friend, he hits the nail on the head, because the parts of Greater Manchester that both he and I represent, these health inequalities are stark, they're visible, and we are going to turn them around. That's why our health mission pledged to tackle the social inequalities that influence health and to ensure that children have the very best start possible to give them the building blocks for a healthy life. This will be an immense challenge, but every member of this government is up for the battle. Now, colleagues have made a number of points, and I'll try and answer as many as I can in the time we have left. Firstly, I want to pay tribute to the honourable gentleman, the member for Harrow East, for the work that he's done on this for a number of years. And I want to assure him that all tobacco products are covered by this bill, including the chewing tobacco product that he referred to. My honourable friend, the member for City of Durham, who equally has been a passionate spokesperson for tackling smoking harm, is absolutely right to raise the issue of Article 5.3. The new Labour government takes very seriously its obligations as a party to the World Health Organisation's FCTC, and we remain fully committed to the Convention. This includes the important commitment under Article 5.3 to protect public health policies with respect to tobacco control from commercial and other vested interests of the tobacco industry. The Shadow Secretary of State referred to the powers to bring in smoke-free places, and we will consult on extending those smoke-free places to outside schools, children's playgrounds and hospitals in England. We believe this is the right balance to protecting the most vulnerable whilst recognising the current pressures facing the hospitality sector. I do want to make him aware, though, that this bill has been designed in full consultation with and to meet the needs of the devolved governments across the whole of the United Kingdom. It is a UK bill with powers that meet the requirements of each of the component parts of our country, and I reiterate that as far as England is concerned, this government will seek to consult on schools, children's playgrounds and hospitals only. On stop smoking services that a number of members, including the member for Harrow East, raised, we are putting an extra £70 million into local stop smoking services, which could help up to 200,000 successful quits a year. We are still rolling out a smoke-free pregnancy incentive scheme. We're supporting pregnant women to quit, and we're ensuring that more babies don't suffer a hit to their life chances before they've even been born. I think the honourable gentleman's just talked himself into a job, and he's absolutely right that the best people to advocate for stopping smoking are former smokers themselves. And then we will still be encouraging adult smokers to switch switch to vaping through Swap to Stop in England, and I'm delighted that localities have asked for over 500,000 starter kits so far. And on advertising regulations, of course, the consultation will take place after royal assent, but I hope I can assure him that we will take away his points to ensure that the NHS is still able to advertise Swap to Stop under those regulations. In terms of a tobacco industry levy, fiscal matters are a matter for the Treasury, but I'm sure that his and others' views have been communicated to ministers there. The Honourable Member for Lewis mentioned the rise of the black market, and look, this is a line that has been parroted by the tobacco industry for years, and I think we need to spell out some facts here, because whenever the government, in whichever guise it has been, has introduced targeted tobacco control measures, the black market has actually not prospered. Consumption of illegal tobacco has gone from 15 billion cigarettes nearly 25 years ago to just a tenth of that amount last year. And when the last Labour government raised the age of sale from 16 to 18, the number of illicit cigarettes fell by a quarter. But what that does require then is better enforcement, and we will use every second of the generously long buffer period to support businesses in preparing for and implementing the changes, including through information campaigns. We are providing £10 million for trading standards to increase their capacity and capabilities next year, and there's £100 million for Border Force and HMRC over the next 5 years to tackle illicit and underage sales. The bill also allows trading standards to issue on-the-spot fines of £200 and be able to reinvest the proceeds of those fines and indeed of the licensing regime back into further enforcement. In terms of a licensing regime, there were a number of questions posed by the Shadow Secretary of State, the Honourable Member for North Shropshire, my honourable friend, the Member for North Dorset, and others. And I want to reassure the House that across the sector there is a broad consensus for a licensing scheme amongst retailers, with more than 4/5 of retailers expressing their support. Now, unlike alcohol, there is currently no requirement for tobacco to have a licensing scheme, something that a lot of people outside of this House would actually find it really hard to understand, because they assume that convenience stores and supermarkets and other places that sell alcohol are similarly licensed to sell tobacco products, and that isn't the case. So we will be bringing in a licensing scheme because we know that that will have a huge public health impact in the same way that other licensing regimes. Look, the fact is local government is going to take the lead on this, and we will, Madam Deputy Speaker, be consulting widely on how we bring forward the licensing regime and how we implement it through secondary legislation following that consultation. An impact assessment will be prepared before the secondary legislation is introduced, but I want to work with local government across England, and I'm sure that ministerial counterparts in other parts of the United Kingdom that are seeking to bring in a licensing regime will do the same, to ensure we get this right for local government, including ensuring that the cost of running a licensing regime is met by the licensing regime itself. My little friend's absolutely right, and in the engagement I've had with members across local government and across all parties in local government, both elected members and officers, directors of public health, they want these measures and they're up for introducing these measures and to helping us get these measures right. The Honourable Lady, the member for North Shropshire, also raised, as did a number of others, the issue of ID checks. And on ID checks, I'd just gently say to those that have a degree of scepticism here is that most retailers already follow recommended practice and regularly ask customers for ID. We are stopping people from ever starting smoking, and 83% of smokers start before the age of 20. This means that someone who has never previously smoked is highly unlikely to want to take up smoking later in life. And our published modelling shows that smoking rates in England for 14 to 30-year-olds could be close to 0% as early as 2050 with the measures in this bill. I will give. And that's absolutely crucial. As part of this, Madam Deputy Speaker, we have to make sure that we don't take our foot off the pedal when it comes to education and informing the next generation of children of the harms of smoking and of vaping as part of our public health initiative going forward. That's a really important point, and it allows me to place on the record my thanks to the health ministers in Scotland, Wales and in Northern Ireland for the way that they have approached our desire to bring all parts of the United Kingdom together and to make a smoke-free United Kingdom and not just a smoke-free England as part of this legislation. And I hope that I can reassure my honourable friend that I have had incredibly fruitful conversations with the Health Minister in Scotland, in the SNP Scottish Government, and that she is as wedded and committed to this bill and the measures in this bill as we are here in this House today, and that I am reassured that across the whole of the United Kingdom we will be walking in step to ensure that the next generation of children never ever take up smoking.
That's because we're better together.
I won't give way now. I do have to close my... So, Madam Deputy Speaker, I know that you are keeping a very careful eye on the clock. If I had more time, I would have talked about the huge public health benefits of the bill that will do so much to prevent death, dementia and disability in old age. I could have gone into further detail about the economic benefits of the bill, getting people back into work and saving untold sums of money for our NHS. But from my perspective, the single most important thing this bill will do is to tackle those stark inequalities across our country, because this fight is personal to me. I have seen the harmful effects of tobacco on the people around me my entire life. As a schoolboy, I was educated about the harms of smoking, but it did nothing to stop a number of my peers becoming addicted to cigarettes. As an MP, I've seen firsthand how tobacco has devastated deprived communities across our country, not least in Greater Manchester. As a Minister for Public Health, I'm determined to end the cycle of poverty and ill health, the blight of addiction, disease and despair caused by smoking. No longer will it sap the strength of our cities, Stoke, Sunderland, Salford and so many others. This is the will of His Majesty's Government. That is the promise of this bill, and I urge colleagues from across the House, vote with us, protect your constituents and do the right thing.